some more questions here to practice. Which one of the following findings will be more probably the nurse observed in a client with myasthenia gravis in crisis? Tachypnea, tachycardia, hyperreflexia, exophthalmos. What is the answer that you prefer in this simple question that you could have in your Nclex?
Tachypnea.
Okay, okay, let's analyze the probably answer of a percentage of you that could, have this confusion. What is the problem in myasthenia gravis? They are strong or they are weak?
Weak.
They are very weak. Okay. Can a person that is weak, so the muscles are weak, and you know that you use to breathe a muscle because it's basic, is high school, more high school, elementary school, that we use a diaphragm, which is a muscle, to breathe. Yes. So it's something that we know. If the muscles are weak, can we breathe fast?
No.
No.
Critical thinking, common sense, logical, abstract thinking, no. So please take care in analyzing a little more the answers, okay? Because, this is the way of being successful. So tachypnea means that the person is breathing fast. If a person has a disease that produces severe muscle weakness when it's in crisis, the problem is that the patient is not NOT, not breathing. Is breathing very slow, very superficial, and for that reason is what you expect to find in a patient with myasthenia gravis. You expect hypoventilation. If the patient has a myasthenia gravis in crisis, how do you expect to be without assistance, without any care, medical care? What do you expect to be the CO2, high or low?
High.
I couldn't hear. Can you repeat?
High, Professor.
Are you sure?
Yes.
Okay, that's what I want, to be very sure. The patient is hypoventilating, okay, hypoventilating, and we know that when we hypoventilate, the PCO2 elevates because we cannot breathe out the CO2 that we normally produce in the metabolism in all the cells of the body. Is an important concept. And how you expect to be the pH, high or low?
Low.
Low. So this is a respiratory problem, no? If you use, as I use, okay, the trick of Rome, respiratory opposite. What means those arrows? How are those arrows? Equal or opposite? Are opposite. And what is the letter that is associated with opposite? R of respiratory problems. Yes. So this is the kind of question that you can have in myasthenia gravis. Okay. So no is not tachypnea. So the best answer is
B.
tachycardia. Yes. Are you sure?
Yes, Professor.
Why are you sure? Why a person has tachycardia when they cannot breathe?
He tried to compensate.
Yes, you activate the sympathetic nervous system because you are in panic. Don't you think if in God forbid, no, I'd like to die with any disease that doesn't produce shortness of breath or low oxygen in my body? Okay, because it could be horrible because it's the number one need a person has, oxygen, and any condition like myasthenia gravis in crisis that produce a low oxygenation is immediately sensed, perceived by the brain, and the brain enters in panic. I don't know if you can visualize that, if you can, the possibility of making an abstraction And imagine a person that is not having enough oxygen in the brain, how the brain is going to respond. And you know, when brain enters in this distress, immediately activates the sympathetic nervous system. Sympathetic nervous system increases heart rate. You know, tachycardia is a manifestation of the sympathetic nervous system, and is a way of compensation, of course. So the answer of this question is tachycardia. It is a simple question, it's an easy question, but sometimes some people commit mistake. Of course, hyperreflexia, if you have weak, you cannot have hyperreflexia. And exophthalmos has nothing to do with myasthenia gravis. What is the name of the disease that produces exophthalmos that we should know for Nclex?
Hyperthyroidism, Graves' disease.
Graves' disease. The form of hyperthyroidism, this is called Graves' disease. Very good. Okie dokie. So this is a simple question, but don't commit mistake in simple questions, no? Because then the people that write the English become upset. They say, come again in 45 days. Next question. The nurse is in the room of a mother with a child born 8 hours ago and who presents with a temperature of 97.5. 97.5 is, you know, a little low for a newborn. Remember that newborns have a challenge, which is the conservation of the temperature. They have tendency to hypothermia, and it is an inferior limit. Okay, so it's concerning. Which nursing interventions are recommended in this case to let all that apply? So let's go one by one as we do in select that apply, and let's say if it is true or false. Place the child in contact with the mother's abdominal skin. Is okay?
Yes.
Yes.
Yes, because if by conduction, the warmth of the mother will be passed to the baby, a part that we promote on bonding. Inform the provider. What do you think about this?
No yet.
No.
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 Okay,
No.
so if I wear my ankles, I put here a quotation mark because I'm not sure. In this moment, I'm not sure. Place the child in the warming radiant bassinet while changing the diaper. Is this correct?
Yes.
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 I'm just trying to reproduce questions based in the stuff that I heard, which don't necessarily are 100% certainty. But you know, one of the options was this, and it brings me doubt. Swaddle the child with a double blanket.
Yes, the temperature is a little
Yes.
low. Yes.
So layers promote warmth,
Yes.
and swaddling the baby is okay. So I also agree with you that is yes. Remove the cap for better observe the fontanel bulging.
No.
No, because the
No.
cap is important. It's
It's
important
important.
to prevent
Mhm.
hypothermia because
Mhm.
the big head that babies have is a big surface of radiation of temperature. So I'm still having doubt about informing the provider because it is not a temperature that is critical because it's in the inferior limit. And the baby is nothing described there that is in distress. I think that those are independent nursing intervention that doesn't require the participation of the provider. If for any reason the temperature doesn't improve or the baby presents any sign of distress, okay, we should inform the provider. But considering again that in this question, the baby is not having a critical hypothermia and is not described to be in distress, there is not a real necessity of informing the provider because we can't prevent the descent of the temperature with these three interventions. So if I were in my anchors, I would also leave this one blank. But I don't want you to be overconfident. I want you to think twice when there are, especially when there are not very clear options. Is not a bad habit, is not harmful to think twice. Those on those you know, confusing or polemic or difficult to answer options, okay? And it's better to leave that in blank. So it is my opinion, is my suggestion in similar situations in your English. But I don't want you to be overconfident. I want you to think twice some options, okay? Preferably all the options, but this one, at this, think twice, is my advice. The nurse is preparing a client with 28 weeks gestation for intravaginal ultrasounds. Okay, intravaginal ultrasound, 20 weeks gestation. Which nurse statement is correct? So we are looking for the correct answer. The procedure doesn't cause any discomfort. You must have your bladder full. This procedure is usually done once during pregnancy. You must adopt the lithotomy position. Of these four options, which one you consider is the one that is correct?
D. D.
Any other opinion? Everybody is going to D as in diamond? Yes. Why not A?
Intravaginal.
Because really it produced some discomfort,
Yes,
you know.
of course. So take care, okay? So first, see this absolute. And second, sorry, introducing a probe in the vagina or any cavity of the body is not comfortable. Okay, so discomfort is produced. Why not B?
The bladder must be empty.
Always?
Well, in this case, in this type of
Yes.
ultrasound,
Intravaginal,
yes.
yes.
Nothing
After
than
after
other.
20 week,
Yes, it's important to know if the person is not pregnant, not pregnant, or the pregnancy has less than 20 weeks, the bladder should be kept full to easier visualize the uterus and the uterus cavity. So bladder is kept full when the woman is not pregnant or when the pregnant has less than 20 weeks, because it's important to have the contrast of the liquid of the bladder and the little uterus, okay, and it's important to have this contrast to see better the uterus. When the uterus is bigger, more than 20 weeks, has a lot of liquid inside, and then there is no need of the bladder. The bladder is, by the contrary, interfering in the process and making it more uncomfortable. So it's good to remember. That before 20 weeks, and in non-pregnant women, probably the doctor will prefer, or the sonographer will prefer to have the bladder full to easier see the uterus. This procedure, so this is no, okay. This procedure is usually done once, no, could be done as many times as they want. It is an absolute that is unacceptable. Very good, perfect. Nursing teaching for a client going to a colonoscopy, select that apply. So let's go one by one, true or false. Cleansing enemas and or polyethylene glycol preparation is required. Yes or not?
Yes.
Yes. So the colon need to be clean, and it can be obtained with cleansing enemas and or the polyethylene glycol is this substance that is dissolved in water, cold water, and you need to drink all the volume very fast in a short period of time, and it's very effective. Of course, the patient needs to be in a clear liquid diet. You will be resting in on right lateral with left leg flex, which is called Sims position. Is this correct?
No.
No, it's all the way around. No, the left
Left lateral, yeah.
left lateral with the right leg flex. So it is wrong. You will receive sedation. You cannot drive until next day. It is true or false?
It's true.
False.
Why false? It is very painful. The colonoscopy is very uncomfortable. You feel cramps in the belly, and it's not comfortable. So you are going to have a deep sedation. Yeah, a deep sedation, not superficial, deep sedation, usually propofol or yes, deep sedation. So the recommendation is you need
Drive.
somebody to drive you back after the period of observation because it is something that can be done in doctor's offices, but the patient is left for a while in observation to be sure the patient is stable and no complication of the colonoscopy occurs. And once the patient is discharged, somebody need to drive the client home. And for that, and of course, the rest of the day is you are going to be drowsy, so it's not safe to drive. So take care. Yes, those endoscopies require sedation. Upper GI endoscopy, lower GI endoscopy, which is a colonoscopy, cytoscopy, okay, bronchoscopy. Okay, all those procedures that imply endoscopies and yes, and frequently punctures, etc., or require sedation. So you need to be very careful that the patient, for safety, and it's important that we remember that safety is a priority in Nclex. So the reason for not driving is safety, and it is a priority. So we cannot commit mistake in this. Okay, so next time, more careful with this. Okay, you will receive sedation. You cannot drive until next date. It is correct. Bloating and abdominal tenderness is expected after the procedure. It is true?
Yes, it's true.
It is true because during the procedure, air must be insufflated in the colon to separate the walls of the colon for better visualization. So after the procedure, you can have bloating and gas, and you can have abdominal tenderness. Nothing like peritonitis, nothing like board-like rigidity, nothing like rebound tenderness, etc., etc. But yes, tenderness that when you make deep palpation is possible in the abdomen. The procedure takes 2 to 4 hours to be completed. What do you think about the time that takes a colonoscopy to be done?
30 minutes.
Yeah, 30 minutes is
Less
enough.
minutes.
Yes, it's a less time. Okay, so it is not. Okay, so I think it's an easy one, but it's not harmful to discuss, okay, because it is the purpose of this, to discuss, okay, details that sometimes we don't have clear, and it's good to discuss. The nurse is administering the drug Epoetin alpha prescribed to an older client. Which laboratory test should the nurse evaluate for the desired outcome? Blood glucose. It looks like it's a cell that apply. Yes, it is a SATA. Okay, so cell that apply. Sorry for that. It's a SATA. Blood glucose, potassium, hemoglobin, BUN, hematocrit. Which one need to be, selected?
E.
E and
select.
C.
Yes,
E as in Edward?
yes.
And
And
in the other?
C, hemoglobin.
Sí.
C as in cat, okay? Because the purpose of giving Epoetin alpha is to stimulate the stem cells that produce red blood cells and hemoglobin to produce more. Is the equivalent of the natural hormone called erythropoietin that we produce in the kidneys. This kind of medications is given generally to patients in dialysis, patients with end-stage renal disease that have deficiency of erythropoietin because of the renal damage, or people that have very tired, old, depressed bone marrow. So it's not rare that very old people have a refractory, anemia that is not responding to iron and vitamins, and is helped with Epoetin alpha. Okay, so just this is the purpose. Very good. Somebody knows when the doctor must stop the administration of Epoetin alpha?
When hematocrit get 33.
Yeah, more or less. Okay, the hemoglobin 12, hematocrit 33. Okay, 11, 11, 12, see, until 12:33 hematocrit. Okay, more than that can produce hypertension, and increased risk of thrombosis, of coagulation or thrombosis, thromboembolic disease, because the blood can become too thick. Okay, so it is true. Okay, this substance requires care similar to insulin, so must be kept in refrigerated, never frozen, and you should never shake the medication because then you denaturalize the hormone, and it's very expensive. It's administered intravenous or subcutaneous. These two options of administration.
Cutaneous.
Both
Both.
can be. Sorry. I made that as a question, and is an statement. Can
Okay.
be given subcutaneous
Thank you.
or intravenous, both. Okay, so in patients that are in dialysis, generally, you know that they go to dialysis 3 times per week. Generally, is given 3 times per week the Epoetin alpha. Immediately after ending the dialysis in their own dialysis center, the nurse administers IV through the same catheter through which the dialysis was done, through the catheter that the blood was returning. Before removing the catheter, the nurse administered the IV Epoetin alpha. If the patient is not having, this situation, then like this old man can be given subcutaneous. Notice that it's also similar to insulin. Insulin also is given subcutaneous or intravenous. Yes, specifically the regular. No, but I commented this because I saw somebody had a question in English, the Celevar applied, which kind of care requires the Epoetin alpha, being such a expensive medication, and included all these details that I mentioned before, that must be preserved in refrigeration, should not be frozen, should not be shaken, is administered subcutaneous or IV, and should be discontinued when the hematocrit is 33, the hemoglobin 11 to 12 grams. The nurse is preparing medication. Yes.
It's just the person that's on your team. The counselor.
Ah, no, eso no es conmigo. The nurse is preparing medications to be administered to 4 acute clients. Which of the following medications should be administered first? So this is a question of prioritization. Yes, which one needs the medication first? Normal saline, high rate to a client with diabetic ketoacidosis, which is severely dehydrated. Betamethasone nebulization to a client with asthma exacerbation. Methotrexate to a client with lupus exacerbation. Metronidazole to a client with pseudomembranous colitis, which is the name of the disease produced by Clostridium difficile, or C. diff. This is equivalent, okay? So C. diff, what you know as C. diff is the same as pseudomembranous colitis. It's something that maybe some of you need to know, because sometimes they don't use the word C. diff. They know the agent. They say the disease. This is the agent. This is the bug that produces this. This produces this, but they are the same. Okay, so if they are in the question, it's the same. Okay, just an opportunity to mention a terminology that maybe you don't know. Maybe some of you don't know. Okay, so of these 4 priorities, which one is the first to be administered? Which is the priority?
A as in apple.
B.
A.
Okay, you have the option of B and the option of A.
A.
Okay, what is your concept about the inhaled steroids in an asthma attack?
Or
Prophylactic.
after the albuterol. Albuterol is first.
Okay, so there is no indication
It's
of
not, no.
inhaled steroids during a acute crisis. This is a medication used around the clock every day for the management of the chronic, inflammation the patient with asthma can have. So the inhaled steroid have not any role in the management of the acute asthma attack. Okay, so it's not a priority. It's not a priority. And if it is given, because it's due, must be given after the bronchodilator. And why need to be given after the bronchodilator? Why the inhaled glucocorticoid must be always being given after the bronchodilator? Who can answer me that?
Doing bronchoconstriction.
Because the inhaled glucocorticoids induce bronchoconstriction. You understand? When you inhale alone, only glucocorticoids, betamethasone, okay, or budesonide, or fluticasone, which is the one most frequently used. Yes, these produce as a reaction bronchoconstriction. This medication isn't a bronchodilator. And is an anti-inflammatory medication, which is the other component of asthma. But by the contrary, induce this nebulization of a medication that doesn't act in the muscle, or the circular smooth muscle of the bronchi, produces, but because it's a foreign body there, is producing bronchoconstriction. That's why should be always being administered after or together a bronchodilator, because alone produces bronchoconstriction. So this is a trap. There is a trap in this question, because by ABCs, yes, asthma is a priority. Yes, asthma is a priority. But the medication is not a priority in acute asthma. You know, so this is a trap in this option, and you need to be prepared for that, because they're exploring your knowledge, this knowledge that we are discussing here, that albuterol is the only only emergency rescue medication to be given in asthma attack. In betamethasone, dexamethasone, etc., is not, a priority in acute asthma attack. Is the concept, the knowledge that is explored. So that's why the word betamethasone disqualify this option, even if an asthma attack. This is an asthma exacerbation. Not necessarily an asthma exacerbation is a patient critically ill, is ill but not critically ill. The betamethasone need to be given, probably not in nebulization, but anyway, the concept that I want you to have in mind, that they are going to explore this, the solid knowledge that only albuterol is the one that can be used in nebulization in an asthma attack. It's the only one that is a priority in a patient, no betamethasone. So don't fall in traps, okay? Don't fall in traps. So I hope that my message is reaching to you. The only medication that can be used together with albuterol in case of acute asthma attack is the ipratropium. Ipratropium combined with the albuterol. Okay, so ipratropium plus albuterol can be given together in acute asthma attack, but the inhaled steroids have no role in the acute asthma attack. It's a medication used around the clock every day in asthmatic lives to prevent the asthma attack. So I hope that the message has been delivered. So this option is a trap. So now the next priority that is here is C, circulation, because we have a patient with important hypovolemia. So it's a patient that has a volume of liquids in the circulation that is lower, significantly lower than normal. So the priority here, of course, is the administration of the fluid in a client with diabetic ketoacidosis. When they say diabetic ketoacidosis, because the patient is having diabetic ketoacidosis. Okay, the methotrexate is an immune suppressor that, of course, it's important, but is not the priority, and it's not the most frequently used immune suppressors in lupus exacerbations. And glucocorticoids, cyclosporin, azathioprine are the most commonly used in exacerbation of lupus, in exacerbation of lupus. And metronidazole, the antibiotic, is indicating pseudomembranous colitis, but is not a priority, can wait perfectly half an hour. And of course, the priority here is the volume restoration in a patient with severe dehydration, which is the case of diabetic ketoacidosis, in which the priority is the dehydration. The nurse is teaching. Now you understand why sometimes even studying and even having the knowledge, because I bet that everybody knows that albuterol is the only medication to be used in acute asthma attack. Okay, why sometimes we commit mistakes and then we have the frustration and need to take the test again, you know? And this is something that we can avoid if we are a little more careful, a little more careful. And I don't want you to be insecure, but not overconfident, or always think a little and discuss with yourself the option that you selected. And if in any moment during the career somebody taught you that you should not change your answer, I'm so sorry. Personally, me, Professor Vallin, disagree with this recommendation, because sometimes you realize, oh my goodness, I selected this, but no, this is not a priority. So I need to change my answer. The only moment in which you should not be changing the answer is when you don't have any idea what they are talking about, and then you pray. You say, hey, San Lazaro, help me, or whatever, and then whatever the Holy Ghost inspiring your brain to select, you select that and move on, because this is just a guess. Is that what I do when I play the lottery, but I never gain. The nurse is teaching pregnant women in the prenatal clinic. One client asked when the best moment during labor is to receive pain drugs without slowing labor or affecting the baby's capacity to breathe. The nurse responder answer should be second stage while pushing, first stage latent, a T is missing here, latent, okay, phase, first stage active phase, first stage transition phase. What do you think about this? What do you know about this? What do you think?
First stage active phase is CS in cat. Is what I know.
Anybody else have opinion? Okay. What means that affecting the baby's capacity to breathe? What means this?
Hypoxia, the baby.
Okay, but what relation have the pain drugs with baby's capacity to breathe and the moments of the labor? No idea? Okay. The concept is that when the medication that could depress the respiratory center, frequently opioids are used in the management of labor pain, is giving near okay, the moment of birth, then the concentration of the drug in the baby at the moment of birth, okay, of the baby in the moment of birth is going to be high. And then the first that the baby needs to do when it's born is to breathe. But now is born with a medication that is depressing the respiratory center. So which of these stages are contraindication of this medication because can affect the baby?
Latin.
The latent is very far from the moment of birth. Okay, the first stage is the first stage is since the beginning of the contraction, the first pains, until 10 centimeters, no? 10 centimeters, from 0 to 10 centimeters. From 0 to 3 is the latent. It's a very slow pace labor. Then comes the active, okay? All this is the first stage. Active, that is 4 to 7 centimeters of dilation.
In this phase.
Okay, this is I'm just trying to make you understand what means that pain drugs in labor can affect the respiratory center of the baby, and understand that if pain drugs are given, because as a fact they are given, need to be given in a specific moment in which it is not risky for this challenge that the baby has, which is breathing. And just explaining that which one of those phases are, and then come the transition that is from 8 to 10 centimeters, okay? So the first stage, has these 3 phases, okay? And then comes the second stage, which is the moment to push and to spit out the baby, yes? So obviously the phases that are nearest of the birth of the baby are transition and the second stage. So in the first stage, the transition, and the second stage should not be given this kind of medication, because then the medication is going to be very high, very how do you say that? High concentration, very recently given, okay, at the moment of birth of the baby. You understand? So if you give that, this is almost the end, or this, that is the end, almost the end, yes? If you give that in those moments, yes, and those moments, obviously the baby is going to be very high in the medication and would have problem to breathe. Make sense? And this is what I wanted to make you understand, that why should not be given in the transition, that is almost the end, or the stage 2, which is the end, okay? Because the medication would be too strong in the baby at the moment of birth. The latent is not a good moment to give the pain drugs, because latent, as I said, is a slow dynamic, and can arrest, can stop the uterus contraction. And the pain is not very intense in latent. So the moment that is the longest and the pain is the strongest is probably the active phase. Is the best moment to give the medication. Why? Because you kill 2 birds with the same shot. In one side, you improve the pain without slowing the uterine activity. And second, you are still several hours from the moment of the birth, and the own metabolism, biotransformation of the liver of the mother, will degrade the medication, and the concentration of the medication in the baby will be low. This is the rationale of that, so we don't need to memorize, okay, in which moment is given. We understand why is this moment the best, why C is the right answer. When we understand, we can apply the knowledge to a different question, which is a problem that you have. A problem that you have, my student, I'm talking about my student, is that you think that the question must repeat exactly the same the next time. No, I can change the question. Each time I change the question and I use a distractor, the right answer of the previous version, 50% of the class answer the previous version answer instead of the new version answer that has the same explanation. And memorization doesn't work for Nclex. Understanding, yes, work for Nclex. And this is the purpose of your study, trying to understand the why is this is the answer. Okay, let's move. The charge nurse observed an LPN giving oral medication to clients in an infection disease unit. Oral medication infection disease unit, LPN. The LPN is correct when wearing gowns and gloves to the care for client with Legionnaire disease pneumonia, client with hemorrhagic conjunctivitis, client with Klebsiella pneumonia, client with laryngeal diphtheria. What is the right answer of this? The LPN is using gowns and gloves and have these 4 clients. Which of these 4 clients requires this kind of PPE?
D.
Okay, I assume that you say B as in boy, no?
No, D as in David.
D as in David. Okay, D as in David. Okay. Which kind of infection control is diphtheria?
Droplet.
Droplet.
And what kind of PPE you need to use in droplet?
Mask.
Oh, sorry.
Regular surgical mask. And why then
Yes.
if you know that, why you answer that?
Oh, sorry.
If you know that, why you answer that?
Yeah.
You say that sometimes after we answer.
No, because the professor has a question. Diphtheria, I have in contact precaution when this is in the skin, no?
There are 2 types of diphtheria. The laryngeal diphtheria, pharyngeal diphtheria, and the cutaneous diphtheria.
Cutaneous diphtheria.
The classical diphtheria is the laryngeal, is the most common, and is the D of a Spider-Man. The D of a Spider-Man, which is a droplet. Yes, cutaneous diphtheria requires contact. So take care with these little details. Laryngeal is when the bacteria is in the throat and is expelled in the respiration with the droplets. That's why it's better to use a mask. But when it is in the skin, only in the skin, producing ulcers in the skin, which is a rare presentation of diphtheria, then it is contact. Because it was in one student Nclex, I included this in the recommendation to learn, no? That they have to infection control. But here they're saying laryngeal diphtheria. So no, it's not laryngeal diphtheria because laryngeal diphtheria requires a regular surgical mask because it's droplet. So if it, okay, let me ask you something. Okay, everybody, if you are wearing chocas, is this type. If you are wearing a gown and a glove, which type of infection control are you protecting of?
Contact.
Contact. Which of these diseases that you see here sounds like contact?
Hemorrhagic.
Exactly. The hemorrhagic conjunctivitis, it requires contact precaution. Yeah. The hemorrhagic conjunctivitis requires contact precaution. It is an epidemic, very contagious form of conjunctivitis that requires contact precaution. So gowns and gloves, okay? The Legionnaire disease and the Klebsiella pneumonia are a standard precaution. Doesn't require to give oral medication, any kind of PPE except the hand washing, which is not a PPE. So remember that Legionnaire disease pneumonia and Klebsiella pneumonia, which is a gram-negative pneumonia, the most common gram-negative pneumonia, are standard precautions. So there is no need to giving oral medication to wear anything except standard precaution, hand washing. In the laryngeal diphtheria, you should be wearing a regular surgical mask. And in conjunctivitis, hemorrhagic conjunctivitis, you should be wearing gowns and gloves. Okay, okay. So that's it. That's it. Very good. Review many times your infection control, trying to memorize all these details, the part that need to be memorized, because it's commonly tested. And when you see a question like this, once you see gowns and gloves, what is that? Oh, this is contact. Which one of these is contact? When there is that, the right option, no? Very good. The nurse is providing teaching to a pregnant adolescent with 15 weeks of gestation. 15 weeks gestation, adolescent. This is important. For some reason, this question need to be with adolescent pregnancy. Which topic should be included in the teaching for this scenario? So let that apply. Complication of the postpartum. Okay, what do you think? Yes or not?
Not yet.
No, yet. I agree with you. It's too early because she will be forgetting, and so the learning will be lost at 40-week gestation. And second is going to bring unnecessary concerns. So I agree with you. I should not answer, should not mark this option. Nutrition during pregnancy. Oh Lord.
Yes.
Especially
Yes.
adolescent.
Yes.
Okay, because she's going to McDonald's, pretty sure. Testing for phenylketonuria, PKU.
No.
It is done in the baby, no?
Yes.
Yes.
In the baby. So still
The
is too
born.
early. For the same reason as A is too early. Normal changes during pregnancy?
Yes.
Of course. Fetal growth and development?
Yes.
Yes,
Yes.
it's pertinent. Rubella vaccination?
No.
No, rubella vaccination cannot be given during pregnancy. Okay, should not be given during pregnancy. Okay, so an easy one, no? An easy one. Very good. The nurse is teaching a client diagnosed with hypothyroidism who will start treatment with levothyroxine. Which topic should be included? Set that apply. Okay, levothyroxine for hypothyroidism. Okay, they don't say the age. Okay, take the medication in the morning to avoid insomnia. Is this true or false?
Yes.
It's,
True.
it's true.
It's true.
Take the medication with orange juice to improve absorption. Is true or false?
Oh,
It is
False.
false. Should be taken with empty stomach. It's
Empty stomach.
important, exactly. It's important to take at first time in the morning and wait preferably 1 hour to have breakfast, only with water. The one that is taken with orange juice or tomato juice or any acid juice is the iron. Okay. Change position slowly to avoid dizziness and fall.
I don't think so.
Okay,
Mhm.
so is this is something that is seen in medication that produce what? Orthostatic
Orthostatic
hypotension.
hypotension.
The levothyroxine tends to increase heart rate and to improve blood pressure. So there is not expected orthostatic hypotension with levothyroxine. So
Mhm.
obviously it sounds like a distractor, sounds like something false. Okay. Monitor AST and ALT regularly. AST and
Yes.
ALT are liver function tests, aspartame transferase, alanine transferase. Do you think it's needed?
No.
I never heard that the levothyroxine patotoxic. It's a hormone that we have, all we have. So it sounds like it's false. Avoid changing from generic to brand formulation.
Yes.
Yes.
This is correct. Changes those hormonal medication once the dose has been established with the evaluation of the TSH, normalization of the TSH should not be changed the brand because then it requires again testing to determine the adequate dose because the different formulation can have different bioavailability, which changes, okay, the dose of the medication. Those medications are very delicate. It applies to all those medications that have blood levels and medication for epilepsy, okay, that are very critical to avoid changing brands because it's going to change the blood concentrations. The nurse stops to help in a motor vehicle crash. The driver is unconscious on the driver's seat. Which intervention should the nurse do first? Stabilize the cervical spine, carefully transfer out of the wreckage, ensure a patent airway, make pressure on an actively bleeding wound. What do
C
you
as
think?
Charlie. C
Everybody
as
agree?
Charlie.
Everybody agree?
Yeah.
Okay, how you make airway patent in this client?
Put the chin,
Jaw
move the
drop.
chin forward, but don't move the head of the patient.
Don't throw.
Joke throw, yeah.
The you throw. Okay,
That is the
Okay.
word.
okay. Very good. Your throw. Client diagnosed with benign prostatic hypertrophy is going to a transurethral resection of the prostate. Which diagnosis has the priority during the post-operatory? Acute pain, potential for impaired urinary elimination, risk for bleeding, risk for fluid volume excess.
See?
Any other opinion?
Acute pain.
Okay, so interesting. Okay, so I have risk for bleeding and acute pain. So it's healthy to be in the question, say, okay, the patient can have obstruction of the urinary output. Fluid volume excess is not the most probable. Risk for bleeding, acute pain. So if you need to choose between acute pain and risk for bleeding, which one is going to have priority?
Acute
pain.
Why
Bleeding.
acute? Why acute pain?
Epic C.
Bleeding.
But what you think that acute pain has predominance over the risk for bleeding?
No, I don't think so.
No.
The
No,
pain don't will kill
bring
you.
it, don't bring infection because you are overthinking. No, I'm trying to correct because any one of us, guys, I've been dealing with very smart people like you during test, and I want to take off my shoes and start beating people in the school. And in English can happen
Professor,
because people that I know that are intelligent and are knowledgeable commit some mistake during the test. That's why I'm discussing, because some of you are thinking that acute pain could be a priority. And I want to
no for
discuss.
me.
No, yo sé que
Acute
tú
pain
no.
don't kill you, but the risk for bleeding, a hemorrhage, yes.
Ok, ya va, chico, espérate. Wait a moment.
ABC.
I'm
Sorry.
discussing.
Sorry.
Cállate. I'm discussing why acute pain is not. So I'm convincing somebody acute pain. So I want to give you an advice, the person that's saying that acute pain, because I remember myself when I was very new in this kind of nursing question, having the same confusion that you have. You say acute pain is an actual diagnosis, risk for bleeding is a re-diagnosis, okay? Acute pain, oh my goodness, I am allergic to pain. I don't want anybody to have pain. All this stuff has passed through my mind. I want to give you an advice for English, not for anything, for English. Don't select acute pain as a priority because it's usually a distractor in the majority of the question, unless it is chest pain. It is the worst headache pain that I have in my life. Or this is an excruciating pain that doesn't improve after morphine in a patient with a fracture or any trauma in extremities. Or is the acute pain in sickle cell disease that translate also infarctions? Or in rare situations, the acute pain in kidney stones. Those are the acute pain that I seen in my experience as a priority in certain questions. Obviously, I'm going to repeat, chest pain, the pain of a brain hemorrhage, the worst headache pain of my life, okay? The pain of the compartment syndrome, The pain of the vaso-occlusive crisis in sickle cell disease, because it translates also infarctions. It's not because the pain, it's because the tissue damage. And for pain, just for pain, the only pain that I see as a priority is in kidney stones. Okay, that the priority is the pain. Okay, but in general, okay, pain is something that in prioritization must wait unless the pain represents a damage in tissue like the brain hemorrhage, myocardial infarction, tissue ischemia, etc. So definitively, I agree more with the people that selected, okay, for bleeding. First, because it's an important complication in prostatic surgery. And second is the one that can place a threat in the life of the patient. So if I worked in my ankles, I also would choose risk for bleeding, even if it's a risk diagnosis. Is a very serious, important, and very probable diagnosis we need to be, considered as the priority. It doesn't mean that you are not going to take care of the acute pain, but acute pain in surgery, in prostatic surgery, in the majority of the surgery, is not a priority. It's not so severe that becomes a priority. It's something that can wait, okay, 5-10 minutes for the Percocet or whatever is ordered to improve the pain, and will take like half an hour to relieve, etc. So it's not the priority in this case. So I favor here, based in the experience, the little experience that I have in this kind of question, that risk for bleeding has priority, even if it is diagnosed over acute pain. So I just wanted to discuss with you, the person who said acute pain, that many times in the past, I committed the same mistake as you. And for test purposes, to improve your chance of passing the NCLEX, take care. Don't select acute pain unless you are really convinced that there is not anything else. For example, they have a question in patient with shingles, what is the priority? And the answer is acute pain. Okay, because in shingles, nobody going to die of shingles. Nobody is going to have a life-threatening condition with shingles, but the pain is horrible. So this question is in English, but you don't have any other option. Here, you have an option that is competing seriously with acute pain, which is bleeding. And bleeding is a very common complication of prostatic surgery. As a matter of fact, the indication of continuous blood, because it's accepted as a fact that the patient will be bleeding. Not too much, but it's going to be bleeding. Okay, so that's why I suggest, okay, in similar question, to prefer bleeding as the priority over acute pain. The nurse is carrying out 4 orders for an Rh negative, Coombs positive woman with 24-hour postpartum. The client refers history of egg allergy and has a negative titer for antibody for rubella. Which order should the nurse question? Oxycodone and acetaminophen 2 tablet PO, Rogan intramuscular, yearly flu vaccine intramuscular, MMR vaccine subcutaneous. What you object? What is your objection here?
B.
C
Rogan.
as in cat?
No, B as in boy.
B as
Rogan.
okay. The Rogan. Why the Rogan? Why the Rogan if she is Rh negative?
Yes, professor, but have a com positive.
But the Coombs is positive. When Coombs is positive, there is not indication of Rogan.
Of Rogan.
Sadly, the Rogan is not going to do anything, any benefits in this client. This client has been already sensitized by the positive red blood cells. So summarizing, there is no problem in giving the rubella vaccine, the MMR. There is no problem after birth. The woman has already gave birth, no? There is no problem giving flu vaccine if it is due. And of course, there is no objection given, pain medication, including opioids, after birth. But this woman being comes positive means that she already has antibodies against positive Rh positive red blood cells. It means that it's too late. Is this woman in a previous pregnancy? Okay, in a previous pregnancy, she became sensitized against red blood cells, positive red blood cells, and then when the CUMS is positive, which, as I said, demonstrate the already presence of antibodies, the Rogan has not any role because cannot prevent anything. Do you understand? So the indication of Rogan is Rh negative and CUMS negative in the woman. The CUMS that is done in women is the indirect CUMS. In the baby, the direct CUMS. Okay, that's it. Pregnant woman with 39 weeks gestation is scheduled for appointment in the prenatal clinic. The client calls the nurse with anticipation the day of the appointment, anticipation to the appointment hour to inform that she had a recent exposition to a child with rubella. What instructions should the nurse provide to the client? Go to an urgent care to be evaluated immediately. Come to your appointment this afternoon as scheduled. Go to the local health department to receive a dose of MMR. Come to your appointment at the last hour after all client has been seen. What is the best answer to this question?
Días in David.
B. Días in David, no?
Días in David, yes.
Yes, Professor.
Yes, días in David.
Everybody agrees that. Okay, yes. Obviously, it is the best option. So what we can rule out, okay, receiving the MMR is not indication to receive MMR during pregnancy. This is discarded, okay? And there is no need because she was exposed to somebody with rubella. There is no need of going to an urgent care. There is not emergency or urgency here, okay? So the difference is coming to the appointment at the scheduled time or coming at the last hour. What is the purpose of going at the last hour? To avoid, in case that she is carrying the virus, exposing other pregnant women that can be in the waiting room, okay, with early pregnancies, exposing that. That's why this is the best answer. Yeah, this is the best answer. Yeah, okay. Okay, so look at this version of a similar question, okay, that another student in another moment refers. A 20 weeks pregnant woman called the MD office and informed that she was exposed to rubella and wanted to know what to do. What statement is most appropriate for the nurse to tell the woman? Assure the woman that in that stage of pregnancy, it won't affect the fetus. Tell the woman to come during office hour to be evaluated. Arrange for the woman to come today when all other patients have left. Advise to go to her PCP office and request the rubella vaccine. So again, we rule out the rubella vaccine. This is nonsense, okay? But now we have a similar question with a new option added, okay? So what do you think is the most appropriate to tell the woman during the phone call at that moment? So you can rule out, okay, B also for the same reason that we discussed. So now it brings, okay, doubt. Why? Because this question changed what? The gestation stage and introduce a new option.
Professor, I don't like the word assure. You know, like I'm just telling you that this is not gonna happen to you, baby. I don't like that, and
I
also
don't like that.
the
Neither.
second and third trimester. So it's the second
It's too
trimester.
absolute.
And what you know about the risk of rubella and pregnancy?
Is this in the second trimester? The oh wait.
It's less 20, no?
Organogenic happens in the first trimester, right?
Yes, in the before week 20.
Before. So in the 20 weeks is the second trimester. So yeah, probably, I don't know. Can you help me?
So do you realize that it brings doubt? So sometimes we are going to be in our Nclex with doubt. Because see how easy is to answer this version of the question that is not introduced in this. Okay? ¿Cómo se llama? But now they make another version of the question, and this is something that you will find. Nclex has a huge, but you know what is a huge? A huge bank of questions that is continuously renewed. And one question has a lot of versions, variations in the question that change the answer, change the situation, which is something that I've been trying to convince my students all the time, especially in the afternoon class, that I change the question from the morning test, and then they continue answering the same. That was the right answer in the morning, is not the right answer in the afternoon. So this is what I combat, the memorization. You need to understand the why. This is the answer, because when a little change in the question will change the answer. No? So notice that here we have two options. We have the option, okay, they don't say that this woman has an appointment, okay, is just calling the doctor's office, okay, because she was exposed to rubella and wanted to know what to do, okay, and you have the option, okay, come to talk to your doctors, okay, when all the patients have left as in walk-in, or ¿cómo se llama? Hey, you should know that after, okay, week 18, 20, there is no risk of rubella and pregnancy. So here you have a question that will bring doubt, because notice that there is possibility. So you easily rule out those, but is a possibility of answering A or answering C. Okay. You objects the word assurance. Okay, could be a good point. Okay, a good point. So it's in this case you will be fair, preferring continue answering the same answer. Okay, come in after hours. Okay, but now I just wanted to bring this topic, and this way we can also discuss that rubella after the 20th week of gestation has no teratogenic effect. Okay, I remember a question in Nclex that said that the mother had rubella at the moment of birth. So she was having the baby and she had rubella. Or a few days before the birth, I think was, okay, a few days before the birth, something like this, and she had rubella. Again, okay, there is no concern there is no concern because at this stage of pregnancy, it is not risk for the baby. Even the baby is already protected with the antibodies that the mother produced to defeat rubella, no? So that the own antibodies the mama is producing is protecting the baby. Babies don't have rubella, okay? Babies don't have rubella in the first year. That's why the vaccine is given after the year, no? The MMR, okay. The nurse is sure. Go ahead.
So after you said that in the first semester, in the second and third semester, there is any risk in this case. In this case, is the first option the right choice?
I don't know. I say
Okay.
that we have two possible answers, and I said that that those are both are true,
Well,
both are possible. So I don't think nothing wrong to make an walking appointment today after everybody left, which is nothing wrong in this. So it could be an answer, but even if some of you consider the word assurance um, objectable, it is true that after week 20, rubella doesn't affect the baby. Okay, doesn't affect the fetus. So now you will be in your ankles. So expecting your ankles, you are going to be many times between two options that you need to fight, trying to consider what is the best option. Your fellows found the word assurance like an absolute, and they object option A by this purpose, and that they consider that makes more sense to make an appointment, okay, when there is no risk. And in some way, I think that is very reasonable, okay, very reasonable. But still, this is a version that brings doubt, okay? And be prepared to be in your ankles having this kind of doubt. By the way, you don't need to get 100 in the ankles to pass your test, okay? You can fail some questions, okay? And this is a question that if you fail the question doesn't make you to be in a predicament, because of course if you fail a question of safety, for example, this question that we had that the patient cannot drive until the next day, I wouldn't like you failing this question. I don't know if you remember, it's a question that we reviewed today, and
yeah.
okay, I wouldn't like you failing this question because it translates that you are not safe as a nurse, because it is something, and because you are not thinking, you are nervous, you have a bad day, you can be choosing options that are not good. That's why I don't want you to be overconfident, and always review what you selected and be sure that it is correct, and having safety as a priority. Because, okay, but if we fail this question, which is not, we are not going to fail our English. It's just a question that is malicious. The nurse is evaluating a client with Raynaud phenomenon, which history is pertinent to investigate. Antecedent of allergies, occupation, alcohol intake, use of narcotics. What do you think?
Alcohol intake. I think.
Okay. Alcohol intake, relation with Raynaud phenomenon.
For me, occupation.
Alcohol intake, alcohol is a vasodilator. When you drink alcohol, you become red. If you're white. When you drink alcohol, your face and your ears become very red. Okay, this is the classical, okay, aspect. So alcohol, consider alcohol a vasodilator. So alcohol shouldn't have relation with Raynaud phenomenon. I never heard that have a relation. Smoking, yes. Smoking is a vasoconstrictor, and smoking, yes. Stress, yes. Cold, yes. Beta blockers, yes, because blocking the beta receptors in the arteries promote vasoconstriction. Allergies, I never heard relation between allergies and Raynaud.
Occupation, Professor.
Narcotics. We say narcotics, okay. Oh my goodness. If we say narcotics as opioid, which is the correct term, okay. Opioids are narcotic because opioids are depressors, are drug of abuse that are depressors, okay. So the drugs that depress are the opioids and the benzodiazepines, are the downers, no? The downers are the opioids and the benzos, okay? The opioids are vasodilators. So opioids should not be involved. And benzodiazepines don't affect the blood vessels. So doesn't look, okay? But what I read, that occupations that produce repetitive trauma and vibration, can be a cause etiologic incidence in Raynaud phenomenon. So, for example, those construction workers that work with just the jackhammers and qué sé yo, pianist, people that work with typing, etc. Something similar to the risk factor of a carpal tunnel syndrome, no? Can't also have Raynaud phenomenon. Okay, can have suffer of that. Repetitive trauma in the nerve can produce Raynaud or produce carpal tunnel syndrome. So I would favor, if I were in my anchors, occupation, because I read that certain occupation favors, okay, the development of Raynaud phenomenon. The majority of the Raynaud phenomena are idiopathic, so there is no reason for that. Some are related with connective tissue diseases like scleroderma. Scleroderma has a constant Raynaud phenomenon. Lupus frequently, okay, cryoglobulinemia and others, okay, conditions. But occupation has been also mentioned as in the etiology of the Raynaud phenomenon. Guys, when you have a doubt like this, you need to investigate, okay? You need to investigate. The nurse is teaching to a pregnant woman how to avoid heartburns related to pregnancy, which recommendations are correct. Look at how interesting this question. Avoid spicy food, yes or not?
Yes.
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 Drink cold milk to alleviate heartburn.
No.
Why no? This is so good. When you drink cold milk, you feel this relief immediately. Why no?
Yeah, but after, when the meal is
The
processed in the stomach,
rebound acidity. Yes.
acidic.
Yes. So milk, the casein of the milk, is a potent stimulant of the gastric acid, gastric secretion. So in the moment, I can tell you because I used to suffer of heartburn. In the moment, you feel a relief that is incredible. It's delicious. But then, okay, 1 hour later, you have more heartburn. It's because it rebounds, okay, acidity. So it is not recommended, okay? It's not recommended. Milk is not good for pecto acid disease, ulcers, gastritis, and GERD. Use 2 pillows to sleep.
Oh, Professor. In the normal person, good, but in the pregnant, I think no.
Well, probably pregnant women are using 2 pillows, but you know what says the book? When you have a normal bed, the regular bed that usually, at least before the present time, usually people had a normal bed. And you use pillows to elevate, then you end, let me draw you red, okay? You end like this. Yes, you end like this. So in reality, it's not helping at all the GERD. That's why they recommend better to put in the legs of the bed that is toward the head, okay, a couple of blocks, okay, a couple of blocks, okay, that elevate all the bed. So now you are, sleeping, okay, with a real inclination, okay, a real inclination that keeps the acid in the stomach. So the use of many pillows will produce neck pain and is not helping the GERD that is seen in pregnancy. And this is what they say in GERD. And in pregnancy, the recommendations are the same as in GERD. Don't use pillow. Elevate the head of the bed or use a wedge. A wedge is something more efficient, no? It's something that is like this, and then the person is sleeping over the wedge, no? Over the wedge, so it's different. A wedge is different. When you use pillows, you are going to end, okay, with neck pain, and you are not going to improve your GERD. This is what the book says. Pillows is not recommended. Don't recommend pillows. Recommend the blocks and down. Okay, so I base in this knowledge that is said in the book when they teach us about GERD, gastroesophageal reflux disease. I don't recommend pillows. I recommend the blocks, okay, the bricks in the legs of the bed that are toward the head to elevate all the bed. So I don't recommend that. Have 6 meals per day. Yes or not?
Yes.
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 6 small meals per day. Stay upright after eating. Yes or no?
Yes.
Yes.
Yes. Okay. So as you notice, are the same recommendation we learn in gastroesophageal reflux disease because it's the same. Okay. Pregnancy produces GERD because the mechanical pressure of the uterus in the stomach, and because the progesterone, the progestation, the progestins, okay, provoke relaxation of the lower esophageal sphincter, favoring the gastroesophageal reflux disease. Which of the following nursing situation liability for malpractice? Okay. Which of the following nursing situations are examples of liability for malpractice and require disciplinary action? Select all that apply. So it's a SATA. Select that apply. Nurse informs client's status to her best friend.
Yes.
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 Yes. Yes. Because you don't need to inform unless the person is authorized. Okay. And this is the meaning of this option. Nurse delegate to CNA the dress change of a chronic ulcer after bath. It is malpractice?
No.
Yes.
No.
Yes. Dress change is a procedure that is not in the scope of practice of the CNA. No dress change. Okay, you can delegate the dress change of a chronic ulcer to the LPN, but not to the CNA. Okay, a wound care dress change is not in the scope of practice of the CNA. So good that we have this option, and we can then know now that wound care dress change is not in the scope of practice in of the CNA. When they say dress change, is the dressing, no? Okay. So it is not correct. Nurse released the diagnosis of HIV positive status to proxy with a durable power of attorney.
No.
Yes or no?
No.
No. The person has been authorized legally to receive, okay, the information. Yeah. So a condition of proxy, okay, a condition of being a proxy by durable power of attorney give you the right, because this is activated when the patient is incompetent and the patient is HIV positive and require treatment of the HIV status, whatever, is need of participation of the proxy. The proxy has authority to know that because the patient gave the authority to the proxy. Nurse administered a shot of haloperidol to agitated schizophrenic client refusing medication.
Yes.
Yes, the patient has, even when he is out of his mind, has the right to refuse medication. Nurse administered penicillin and the client developed anaphylaxis.
No. No.
No, this is not a liability for malpractice because there is no any mistake here. It's simply the patient is allergic to penicillin and develop an anaphylaxis. Okay, this is an example of questions. Okay. Okay. Can a CNA, a UAP, CNA, okay? Can a UAP or CNA do CPR, chest compression?
Yes.
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 Can a CNA give a tap water enema under nurse supervision?
Yes.
Yes.
Can a CNA do vital signs, including O2 saturation?
Better sign, yes.
Yes.
And even
Yes.
O2 saturation, so can do pulse oximeter and report to the nurse. Can measure intake and output?
Yes.
Urinary,
Yes.
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 And can a CNA make a scan of the bladder with
Yes.
ultrasound?
Yes.
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 Okay. Very good. Remember that you cannot delegate assessment. You cannot delegate any kind of medication to the CNA. The nurse observed the mother of a 6-month-old infant, male infant with GERD and frequent milk regurgitation. In which situation the nurse should intervene? Mother doesn't use pillows when resting the infant supine. Mother position infant in high Fowler after eating to prevent GERD. Mother position infant prone while sleeping to avoid aspiration. Mother interrupt bottle feeding frequently to burp the child. What is the situation where the nurse should intervene? It means that is a negative question. You need to look for what is wrong.
Sí.
Sí.
Okay, I agree with you. An easy one. C. Okay, the prone position favors, okay, sudden infant death. And in the past, okay, people thought that it was a better position to prevent aspiration, and it's not true. This position doesn't prevent aspiration, and by the contrary, promote sudden infant death. Very good. Correct intervention for a patient with cold position and purple toes suggesting frostbite. Cover with gauze, soak on warm, normal saline. Massage with warm hands to restart circulation. Make the client walk to promote perfusion. Cover with electrical heating pad. What are the best options of these four in case of frostbite?
A.
Everybody agree? Okay, I agree with you. I know that it's contraindicated in massage, and of course, promoting walking because definitively it's going to produce trauma. And electric heating pads, okay, are not the best. Moist heat is the best option. You have the option of using warm water or using soak gas or compresses, in warm normal saline or water. Okay. The nurse admits a client from the emergency department diagnosed with positive HIV and oral candidiasis. With which other client can the nurse cohort this client? Client with systemic lupus erythematosus and glomerulonephritis, client with hepatitis B and clay colored stools, client with HIV and streptococcal pharyngitis, client with Clostridium difficile diarrhea. With which one do you cohort this client?
B.
I agree. Everybody agrees? Okay, the patient with lupus is immune suppressed. okay? Because the disease and the medication they need to receive because the glomerulonephritis. No, need to be alone. The streptococcal pharyngitis is droplets, no? Is the S of a Spider-Man. C. diff is required contact precaution, but the hepatitis B is standard and can be cohorted with HIV that is standard, and candidiasis also standard. So 2 standards can be cohorted even if the diseases are different. The nurse administers the drug rivaroxaban to a client with history of cardiac dysrhythmia. The nurse monitors the client for hypotension, tachycardia, bleeding, jaundice. What do you answer?
Sí.
Bleeding.
Bleeding. Okay. Rivaroxaban, apixaban, and dabigatran are the new warfarin, no? Rivaroxaban, apixaban, dabigatran are the new warfarins. So the question is doing straightforward. For what is this medication? And which side effects, okay, you expect? Those are anticoagulants. And which kind of cardiac dysrhythmia you expect to have this client?
Atrial.
AFib, the
Atrial.
one that requires anticoagulation, chronic anticoagulation. The nurse is preparing to assess head to toe of a 3-year-old child. Which intervention is correct? Explain the child which procedures will be done. Give a sweet cookie and if the child is upset. Gather the equipment in front of the child. Give written instructions to the mother. What is the best answer to deal with a 3-year-old preschool child?
B.
The cookie. Y se le pican los dientes.
For me,
Salen
sí.
caries. Tooth decay. And obesity. What you said? C as in cat.
Sí. Sí,
C
as
as
in cat.
C as in cat. This is the answer. Remember that in the preschool, you need to allow the child to play and to become familiar with the instruments. Okay, so allow the child to play with the stethoscope, to play with otoscope, to play with the instrument, because it's the way that they will lose the fear to the unknown objects. No? So this is the best option. This is a common question in English. Okay, how you deal with a preschool that is afraid, of course, of those strange instruments? Make them play. Play is the way of gaining the acceptance of at this age. So this kind of treats are not healthy and are not effective, because even with the sweet cookie, the child will continue being suspicious of the instruments. But if they play with the instruments, which is a curiosity, meaning they have a lot of initiative, they like to play and they like to investigate, it is going to be the best option. The nurse is assessing a 9-year-old child with frequent nose bleeding. 9 years old, school age, frequent nose bleeding. Okay. Which question is important to ask the child parents? Does your child stick objects through the nostrils? Does your child have seasonal allergies? Does the child pick up on the nose with frequency? Does the child take any vitamin supplement? What do you think is the best to answer in this case?
D.
When you say C as in cat?
I say D.
Oh, D as in David.
Yeah.
D as in diamond. Okay, does the child take any vitamin? Which vitamin can promote nose bleeding? Because we assume that if we ask this, there is some vitamins that can promote bleeding, specifically in this case, nose bleeding. Or are you thinking in deficiency of vitamin K? What is your mind? What is your mind, thinking?
Could it
be
be
checked.
C?
Okay, so do you decide to remove option D as in diamond? Okay, so let's remove option D as in diamond. Okay, so we don't need to take supplements of vitamin K to avoid vitamin K deficiency. Who can tell me why? Even people that are those carnivorous people that don't consume vegetables, okay, like my daughter-in-law, that only consume meat, okay, they don't have deficient vitamin K. Do you know why? Nobody knows.
No.
Who knows why newborns, babies, newborns, requires a shot of vitamin K?
Because
Prevent
no have,
hemorrhage.
Coagulation, o sea,
because
Okay, but
no
you
using the stomach.
in the stomach, no, in the intestine.
In this, yes.
The normal flora, the bioma that you have in your intestine produces vitamin K. Most of the vitamin K that you have in your body is produced by the intestinal flora. It's important. Babies are born with a sterile, no flora, sterile columns, sterile intestines. They acquire the flora from the mother in the contact with the mother. So at the moment of birth, babies have a relative deficiency of vitamin K for this reason, and they have higher risk of having a hemorrhage. They can have hemorrhage in the umbilicus. They can have hemorrhage in the head, inside the cranium. Why? Because they have some head trauma if there is a vaginal birth. So that's why they are receiving the vitamin K. Okay, so it's just one person was thinking in option D as in diamond. Okay, the last one. Do you take any vitamin supplement? Do you have nose bleeding? I can imagine. Remember that one of my roles is trying to think what is in your mind when you are facing a question. Remember that is my job. Okay, to think on what you are thinking, to cut on any deviation of the thinking. Okay, to nip on the bud before it happens. So there is not vitamin deficiency that could explain this nose bleeding. Vitamin E, E as in Edward, okay? Vitamin E in macro doses, so those people take macro doses of vitamin E, has a mild inhibition of the coagulation that could be important to a patient going to surgery or a patient going to, ¿cómo se llama? A procedure or a patient taking anticoagulant. Okay, would be important, but this is not this case. This is 9 years old child that is not in this situation. A child at this age that have nose bleeding, the 98% probability is a benign condition, a very benign condition, okay? Because it's very frequent, especially if they have vasodilation of the blood vessels in the nose when they are playing in hot environment, when they are playing, okay, in doing sports or playing in under the sunlight in hot environment. But ¿cómo se llama? Trauma, okay, is also a possibility. Of course, if we're a smaller child, sticking object through the nostril is very common in preschool. Toddlers and preschool frequently they stick toys, beans, and different stuff in the ears and in the nose, in the nostrils. It's very common. Be aware of that. Be aware of that. Okay, but this is not the age of doing that, so we can rule out that. Okay, So no vitamins, no. So would be left between allergies and picking up the nose fluid. Okay, so when a child has this age, it's not rare they develop the habits of digging in the nose. Okay, and uh, this is this is known a common cause of nose bleeding. Of course, if this is not the cause, then more investigation need to be done, including hematology, because also patients that have coagulation problems, which are not common, leukemia, etc., can have nose bleeding. But we go first through the common cause. And C as in cat is a common question, an important question we need to ask, because at this age, it's not rare that children dig in their nose, and this is a cause of epistaxis or nose bleeding. When assessing a client with AIDS, acquired immune deficiency syndrome, which is related with the human immune deficiency virus, HIV, which findings should raise most concern? So this is a question of prioritization, because the word most translate prioritization. Wide curd-like lesions on mucosa of tongue and cheeks, several vesicle and superficial ulcerations over erythematous mucosa of genitals, multiple purple nodules on the skin and buccal mucosa, positive Western blot test. Okay, what do you think about this question? What is the most concerning of these 4 findings in the patient with AIDS?
Via symbol.
Okay, several vesicles and superficial ulcerations over erythematous mucosa of genital translate which diagnosed?
Herpes.
Herpes.
Herpes genital.
Genital herpes, you said? Genital herpes?
Yes.
Yes.
Okay. What is the seriousness? How can genital herpes being or a, a condition that could make us have the highest concern?
It's less serious.
Is what?
Es menos seria, profesor.
Is not
Okay.
so serious. It's not so serious.
Mhm.
Yeah. So it is a very common viral infections that is recurrent and is not associated with serious health conditions. It could be serious in a pregnant woman that plans to have a vaginal birth, but not for the woman, but for the baby, because the baby can acquire severe infestation in the head of this virus, but it's not this case. So I don't think this is the most concern.
Professor is C.
What do you think is this C? What do you think is this?
Sarcoma.
Yes.
Kaposi. This sarcoma. Okay. What is this sarcoma? What is that? Is an infection? Is a tumor? A cancerous tumor? Is what?
It's a cancer.
It's cancer.
Cancer.
It's cancer. Yeah. It's cancer. Kaposi sarcoma is cancer. It's a form of cancer that appears only in people that are immune suppressed. That that spread, and is very difficult to treat. Obviously, a positive Western blot test is expected because the patient has HIV. So it is expected. And what is A? It is what?
Candidiasis.
Candidiasis, okay, so thrush, which is not life-threatening neither. Okay. So obviously, the worst scenario here is the Kaposi sarcoma, which is a cancer. It's a cancer that is not only in the skin and buccal mucosa, it's also in internal organs. Okay, can be seen in the skin and mucosa, but is also present in internal organs. So the priority here for this poor patient is the cancer, the Kaposi sarcoma. So that's it. The other cancer that patient with AIDS can have is cervical cancer in women. This cervical cancer is very aggressive. Usually cervical cancer in normal women is related with human papilloma virus and is very slow, okay, growth, very slow growth. That's why the pap smear can be done every 3 years or the HPV testing every 5 years because it's a very slow growth. But in case of HIV, becomes very aggressive and rapidly evolving because they decrease immunity. The other cancer is the lymphoma. Lymphoma that is especially in the brain is a very aggressive form of lymphoma that they can also have. Those are the cancers that are associated with immune deficiency. Kaposi sarcoma, which is the most common, cervical cancer, and brain lymphoma. The nurse observed the CNA care of a male client convalescence of brain attack and right hemiplegia. Okay, so brain attack and right hemiplegia, paralyzed the right side of the body. So the left side is the one that is affected. When should the nurse intervene? Is the CNA giving care? And of course, the question is a negative question. We need to find what is doing wrong, the CNA. CNA introduce right arm first when helping client to put on shirt. CNA tells client to use his left hand to eat without helping him. CNA place the wheelchair on the left side when transferring the client from bed. CNA hold gait belt from the left side when assisting client to walk. What is wrong here?
Sí, hacen cat.
C as in cat. Okay, CNA place the wheelchair in the left side. Okay, so suppose that the patient is on bed. This is the bed. Yeah, this is the bed. And the patient is sitting, okay, is sitting, okay, is sitting and on bed, okay, on bed to be transferred. The side that is paralyzed is the right side, okay, let's make it red. The right side is paralyzed, is the weak side, okay? And the CNA is placing the wheelchair is being placed okay, is being placed in the left side. This is right, this is the left side, okay? So this is what says, okay, the question, okay? Everybody agree that is the answer?
Díaz and David.
Okay, so somebody is not agreeing and is saying, I don't agree. I think that is D as in David. Okay. Why you say that C is wrong? Is wrong to place the wheelchair in the strong side?
Yes.
Is wrong?
No, it's not wrong.
It's not wrong.
Correct.
So is the correct. The wheelchair will be placed in the strong side. So when the patient stand up, we'll use this strong side to hold the wheelchair. Understand? To hold to the wheelchair. If you put the wheelchair in the weak side, when the patient stands, won't be able to hold on the wheelchair. But if you place the wheelchair in the strong side, which is the left, because it has paralyzed the right, this is so. Learn that the wheelchair is placed in angle, 45 degrees angle in relation with the bed, but toward the strong side. Okay, if you divide the client in two, you place the wheelchair in the strong side. So when the patient stand and turn, can hold on the wheelchair. Is clear? Is the picture that I wrote clear? Okay, so you need to remember that is important. So it's not C. It's not C. C is correct. C is correct. So now we review something here. We know, because we practiced that last time we met, that we need to introduce the sleeve of the shirt first in the weak side, in the weak arm. Yes, and the weak is, so it is correct. And when the CNA encourage the client to use the strong side to be independent, is doing the right. So encourage the client to use the left hand is correct. So the right answer is D as in diamond. When you are walking, somebody that has a weak side, in this case, the weak side is the right, okay, the right, okay. This is a person that has a weak side, okay. You put the gait belt, but then you be standing, this is the right, and this is the left. You should be standing, the person that is helping, okay, this is helping, should be standing, okay, standing, okay, in the weak side. The weak side, the right, and this is standing at the left. So if the patient is falling, it's going to fall toward you. And if the patient is falling toward you, you are going to put this leg in this position, yes, and you allow the patient to fall toward you, and you slide the patient to the floor. You understand? This is what we do to break a fall of a person that is fainting, or a person that has a weak side and is falling. We stand and hold the gait belt from the weak side, because if the patient is falling, will fall towards you, and you can break the fall. If you are standing in the other side, then the patient will fall in this, and the patient will pull you with him or her. So both are going to fall, and it's going to be embarrassing, and it's not going to be the correct intervention. Okay, so I hope that you are, with my wonderful drawings, okay, learned those little details of transfer and ambulation of patient with weak sight. Ay, Dios mío. Which of the following referrals is correct? Referral 2. Let's see which of the referral is correct. Occupational therapy for dysphagia management of a client with a stroke. Physical therapy to adapt cooking utensils in rheumatic arthritis. Assisted living facility to provide medication around the clock after discharge. Social worker to coordinate prepared meals delivery at home. What is the best or the correct referral or association here?
D.
You said D as in diamond?
Yes.
Yes, I agree. Okay, occupational therapy should be adapting the cooking utensils. Okay, so it is wrong. The dysphagia is managed by a speech therapist, by the speech therapist. Okay, and the ALF is not to provide this level of medical attention. This is referred to the skilled, okay, nursing home or rehab center. Okay, the ALF is for patients that have independence to take their own medications, and the social worker is good to take care of the client's need after discharge, including feeding. And these meal on wheels, okay, these kind of meal on wheels, okay, are something that the social worker can, manage. So this in diamond is a good. It is a common question in English. If you know the role of each one of the multidisciplinary team. Which of the following are risk factors for DVT, deep vein thrombosis? So that apply. Pregnancy, yes or not?
Yes.
A lot. Anemia?
No.
No.
Hypertension?
No.
No. Obesity?
Yes.
Yes. Smoking?
Yes.
Okie dokie. An easy one. Which of the following are manifestations of Parkinson's disease? So that apply. Stooping gait, yes or not?
Yes.
This is a stooping gait, okay? This is a stooping gait that they have, okay? They have, okay? So yes, shuffling.
Yes.
Shuffling when they advance, okay, sliding the feet in short steps. Dry skin.
No, oil.
Yes, it's oily. Okay, but then maybe you don't know that and you put here a quotation mark. It's better to leave that blank. That is very typical. The patient with Parkinson's disease has a very greasy, oily, shiny skin. Okay, it's part of the disease. It's part of the disease. And no, we need to know that. Bradykinesia, slow movement. Yes. Rest tremor. They shake even
Yes.
sleeping. Yes.
Yes.
Hypotonia.
Yeah.
You know.
No.
It's
Hypotonia.
hypertonia.
No. Hypertonia.
The problem of them is the hypertonia. They are rigid because they are stiff, very stiff. So take care with this terminology and this in this title. In the patient with Parkinson, there is a lot of stiffness. It's the most dominant, more than the tremor. The tremor is secondary to the stiffness, to the hypertonia. So remember that in Parkinson, there is a release of the activity of the pyramidal via because lack of the compensation that of the inhibitory action of the extrapyramidal via that work with dopamine. So this predominance of the acetylcholine over the dopamine is what produces this inhibited stimulation of the muscle contraction by the pyramidal via without the counteraction, the inhibitory action of the extrapyramidal via. So there is a patient has a stiffness, hypertonia. It's very rigid. Okay, very rigid. Okay. With the following pregnant client should the nurse first see in the prenatal care clinic? 30 weeks pregnancy with severe heartburn, 18-week pregnancy who doesn't feel fetal movement, 38 weeks pregnancy with bilateral ankle edema, 37-week pregnancy with shortness of breath when supine. Which one is the priority here?
B.
You said B as in boy?
B as in boys.
Yes. Be that in boy.
Okay. So it's concerning that has already 18 weeks, has not yet felt the fetal movement. is a possibility. It's a possibility that the fetus could be dead. What you do first to evaluate? There's another Nclex question. What you do first in this case?
Ultrasound.
Something less
Fetal
complicated.
heart
Something. Huh?
Doppler.
Check the fetal heart rate.
Okay, the answer is if you check fetal heart rate. Check for presence of fetal heart tones. That even you don't need the Doppler, but just Doppler is a very easy method. But even you can do that with a stethoscope. Okay, so this is the answer. Okay, so the first that you do is to check for fetal heart tones. Okay, very good. Nurse caring of a client who came 10 minutes ago from hip surgery and observed pinpoint pupils and respiratory 8 respiration per minute. Which intervention takes the nurse first? Administer naloxone PRN, call the surgeon, elevate the head of the bed, administer oxygen. What do you do first?
Elevate the head.
It's a classical, guys. First, you elevate the head of the bed and then administer the naloxone. Okay. Elevate the head of the bed. First, the independent nursing intervention, then the PRNs, and the last is, calling the physician. So in this case, administering oxygen is not going to help because the patient has hypoventilation, but elevation of the head of the bed will favor the ventilation because will allow a better expansion of the chest with the 8 respiratory movement per minute. And of course, okay, the administration of the naloxone because, the patient is having a important bradypnea. Elevation of the head of the bed, guys. The positioning in respiratory problems is the priority, the first to be done. Just a moment. The nurse assigned to the CNA, the nurse, okay, dice aquí. The nurse assigned a CNA for the care of a client with cervical fracture and a halo fixation. Okay, so the client has a halo fixation because it has cervical spine fracture and is assigned to a CNA. In which situation should the nurse intervene? When the CNA, se lo dará apply. Health client get up from bed holding the halo.
Yes.
Indeed.
Yes, this is disparate. Sits the client in a recliner.
Yes.
Yes, when you see those, remember those halo are very heavy. And when you put the clients in a recliner, okay, okay, the recliner has not been designed by the factory to have a person with this weight in the head, no? And this can make the recliner fall. Administer a sponge bath.
This is correct.
Is correct. Adjust one loose halo bolt.
No, we can correct.
Yes. Yes.
Yeah, you need to mark that. Okay. Report to the nurse erectness on a scalp.
This is correct.
Is correct. So the answer are those 3. Okay. So remember the halo fixation is very heavy and the patient should not lean forward or backward and should never be held through the halo. And these screws and bolts cannot be touched by anybody except the physician. Client is receiving the medication candamycin IV for 5 days. Which findings should the nurse report as soon as possible? Dark yellow urine, tinnitus, pain, and redness on peripheral vein, nausea, and anorexia.
Tinnitus.
Tinnitus. Because candamycin is aminoglycoside. Yes, tinnitus. Absolutely. It's ototoxic. The nurse cares for a client with chicken pox. The nurse isn't immune to the disease. which PPE should the nurse be wearing? Okay, so that apply. Gown, yes or not?
Yes.
Yes, because it is contact. Surgical mask,
No,
No.
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 It
it's
is
a
air.
95.
Face shield. They don't describe any procedure required if you know,
No.
splash.
No.
No.
Gloves.
Yes.
Yes.
Yes, because it's contact. Particulate respirator, which is the same as
Yes.
N95. Yes,
Yes.
those are okay. It's the same as N95. Okay, so chicken pox is two. A part of the standard is two isolation, contact and airborne. Okay. So require these two precautions. The nurse observes the following image on the client's monitor. What should the nurse do first? Check airway, start chest compression, call for help, check the cables. What do you answer?
Sí, sí.
Call for help.
Correct. Check for help. And what kind of rhythm is this?
BTAC.
A
BTAC.
BTAC. So you know that you should not face this rhythm alone, and is indispensable. When you see in the monitor this rhythm, the first to do is to call for help. And now go to assess the client to determine how is this rhythm affecting the pulse. So check for the pulse of the client, for responsiveness and pulse. If the patient is unresponsive and has no pulse, you should start chest compression until the help arrives. Okay, but if the patient has pulse, okay, there is no need of chest compression. No, still no need of that chest compression. Very good. The nurse observes the following image on the client's monitor. What should do the nurse first? Check airway, start chest compression, call for help, check the cables.
D,
Check the
check the
cable.
cables. Check the cables. D.
Yes, because we are seeing here an asystole, and asystole could be two possibilities: a real asystole or loss of contact of the cables. Contact. Okay. Yeah. So first, before calling for a code, you should check that this is not simply a falling, cable, because in this case, the only thing that you need to do is to reconnect that. Okay. So this is what you do. If you were at distance of the client, suppose there is a telemetry unit, and then you can see this image in the monitor, but you are at a distance of the client because this is a telemetry. Yeah. In this, and you cannot go immediately to check the cables. What you can do is to move the button that selects the leads, okay? Because you can have the D1, D2, D3s, ABL, ABF, ABR, Bs, okay? So you can have different leads. There is a button that allows you to select the different leads, okay? So you can have, okay, D1, and then you can have, okay, a D2, and then you can have ABL, okay? So what you do is to change before calling for the code, is change the button to a different lead. Because remember, the client, if it is in a monitor, will have 4 cables placed, okay? And if only one cable falls, producing this image, when you change the button to the next lead, the next lead is using other cables and not necessarily the cable that fell, and then will reappear the rhythm, and you say, oh no, this is the fallen cable because I have a rhythm in the other lead. Okay, in this case there is no need to just call down the nurse to reconnect the cables. But if you continue seeing the flat line in the other leads, which is something that you can do in fractions of seconds, you can quickly change the button to see if there is reappearance of the rhythm in the monitor. Okay, so this is the answer of the different scenario. If the scenario you are far from the client, in this case the question suggests that you are at the client's side, and the best is to check for the cables. Which of the following findings are expected in a client with open angle glaucoma? Loss of red reflex, unable to thread a needle, tunnel vision, dilated pupils. What is the answer?
Yes, you can.
C as in cat. Glaucoma produces tunnel vision after many years suffering, which is found in open angle glaucoma. Expected findings in hyperthyroidism. Select all that applied. Weight loss, yes or not?
Yes.
Yes.
Of course. Irregular and rapid heart rate, yes or not?
Yes.
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 Constipation, yes or
No.
not?
No.
Yes.
It
No.
suggests
No.
more
No.
hypothyroidism. The patient with hyperthyroidism have frequent bowel movement. They eat a lot. Puffy eyelids. The puffy eyelids, edema in the eyelids is more
No.
characteristic of the hypothyroidism than the hyperthyroidism. Exophthalmos is what is found more frequently in hyperthyroidism. Skin hyperpigmentation.
No.
No.
In which condition you find this skin hyperpigmentation?
Adolescent.
Addison.
Addison disease.
Addison's. This is in Addison. You said the hypopigmentation, yes, is in those endocrine diseases. Okay, vitiligo is frequent. Okay, is frequent not only in hyperthyroidism, but also in Addison's and many other endocrine conditions. You can see vitiligo. You know what vitiligo? Those achromic patches in the skin. Irregular menstruations.
Yes.
Yes, both hyper and hypo produce irregularity in the menstruations. Expected findings in the SIADH, syndrome of inappropriate antidiuretic hormones, select all that apply. Decrease serum osmolarity.
Yes.
What is the main element that gives the serum osmolarity?
Sodium.
Sodium. So sodium is low in SIADH because dilution, because the water intoxication. And for that reason, osmolarity also decreases. So it is yes. Decrease urine specific gravity.
No increase.
No.
Right?
No, it's increased.
No.
The urine is very concentrated. The scant urine that is produced is very concentrated and very high specific gravity. Hyponatremia, I said that.
Yes.
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 Dilution.
Weight
Yes.
gain
Yes.
Yes.
because of
Yes.
fluid retention, water retention. Edema
Yes.
Yes.
because of
Yes.
fluid retention. Okay. So don't you notice that the cells that apply, if you know the topic, are not so difficult? This is the experience that we have with Nclex, that the cells that apply are not the most difficult question in Nclex. You are very afraid of the cells that apply. Be prepared to have many cells that apply question in your Nclex. But you'll find that those questions are less complicated than the multiple choice question. Client with Crohn's disease and diarrhea. Correct food selection. Select all that apply. Wheat bread.
No.
Oh,
No, because it has
Lost fibers.
fiber.
Yeah.
Banana.
Yes.
yes.
Banana has no problem. Diarrhea. Banana has no problem in diarrhea. Okay. In diarrhea, banana has no problem. Fish.
Yes.
Is okay. Cantaloupe. What do you think about cantaloupe?
It's water, so it contains water.
It's mainly water, has no fiber. Yes, so it's okay. Oat bran?
No.
No, because it has
No.
fiber. So mainly we avoid fiber. And of course, we avoid excessive amount of fats. We avoid lactose, because they have, okay, intolerance to lactose. So fiber, lactose, and excessive amount of fats are avoided in Crohn's disease. Fiber, lactose, and too much fat, because they have tendency to have digestion difficulties, and fat is, is associated with steatorrhea. The client is prescribed psyllium. Which recommendation should the nurse give to the client? Take with antihistaminic, avoid milk and dairy, take with 2 glasses of water, stay upright for 30 minutes after taking it. What do you answer?
C as in cat.
Okay, and what is psyllium? Something for what?
I don't know, Professor. You can.
Okay,
explain.
psyllium is the
Diarrea,
same
no?
as Metamucil. Do you know what is Metamucil?
No.
Okay. Okay, Metamucil and psyllium is something for constipation. Okay, is a natural fiber. Psyllium is a fiber, concentrated, but is sold in pharmacies, is over the counter, and is something that is a powder, usually have orange artificial taste, and is dissolved in water. Okay, and if you don't drink that quickly, will solidify, becomes like a gel. So you drink quickly that, but then you need to drink another glass of water, because otherwise it's not working, and by the contrary can produce obstruction. So it's very important that taking psyllium, which is a healthy, good way of dealing with constipation, because it's a fiber, it's a very concentrated fiber, the psyllium, metamucil, etc. ¿Cómo se llama? Recommend the client to take it with 2 cups of water, one with the medication dissolved and the second one. Okay, and okay, when you go to any CVS, Walgreens, or Publix, whatever, look in the over-the-counter products. Okay, look for Metamucil or generic psyllium to get educated, because it's something that a lot of people consume. It's something that any neighbor know what it is. Okay, si tú le preguntas a any person in the street, what is psyllium, they know what is it. So we need to know that for the English, please. It's something that is very commonly used. A client is ordered amikacin. Which infection the nurse anticipates the client has? Meningitis, wound infection, septic arthritis, urinary tract infection. Look at this question. Okay, I need to inform you that amikacin is an aminoglycoside. It's in the same family of gentamicin, streptomycin, tobramycin, etc. Amikacin is an aminoglycoside. Okay, and meningitis is treated with cephalosporins, 3rd or 4th generation cephalosporin. Septic arthritis and wound infection generally are produced by gram-positive, and that's why they are not treated with aminoglycosides. Aminoglycosides are reserved generally for gram-negative, okay, infections. So the right answer of this is urinary tract infection. Okay, a resistant or severe urinary tract infection. This is the answer of this question. The client recovering from hip replacement, which of the following positions is adequate for this client? They don't say which side, okay? Supine, semi-Fowler with a pillow under the knees. Supine, high Fowler with adducted legs. Lateral on non-surgical side with abductor pillow. Lateral on surgical side with abductor pillow. What do you answer?
Sí.
Okay, I heard D as in diamond. Okay.
No, B.
Okay.
No, sí.
Sí as boy.
Sí, as in Carlos.
Okay, I heard D and is not correct because it's on surgical side. So you're resting on the surgical side. So it is not correct. And if you say B as in boy, you don't adduct and you don't put the client high Fowler. Okay, because it's being in high Fowler is very uncomfortable. And you don't cross the legs. You don't adduct, you abduct the legs. So the best answer, as you said, is C. But I heard several letters. I overheard several letters. Okay, before that, you need to be very. A semi-Fowler with a pillow under the knees. Pillows under the knees
No,
are
ese es
caca.
Nigash.
Okay.
Pillows under the knees. Okay, learn this. Lay down from me. Okay, lay down from me. There is two stuff that are no, caca. Knee gach. And knee underneath pillows, okay? Okay, why? Because here it is a deep vein here, the popliteal deep vein that is very superficial, and the pressure that makes the pillows or the knee gach. Knee gach is this position of the clinical bed. The clinical beds you can elevate the knees, no? You can do that. This is knee gach. So the client now is going to be like this, no? Like this, yeah. So knee gach and pillows under the knees are caca. Why? Because it produces DVT. This is a cause of DVT. So learn that is in Nclex, okay? Learn that, okay? So the best option here is C as in cat, because it's resting lateral and non-surgical with the legs separated with an adductor pillow. Yes.
Okay, no, I just had a doubt on the lateral, like I couldn't picture.
Non-surgical side, you can be resting lateral on non-surgical side, okay?
But with the abductor pillow?
But with the abductor pillow. Remember that you need to change position, decline every 2 hours at least. You receive the client from surgery, okay? And then every 2 hours, you need to change the position of the client. So you need to have the client supine with the pillow separated for 2 hours. Then you place the client prone with the legs separated for 2 hours. And then you place the client lateral, but not must be on the non-surgical side with the legs separated. Always the abductor pillow need to be between the legs. If you are change the leaning or you are change the diaper, whatever the pain, you need to turn the client, okay? You need to turn the client to the lateral, but you need to keep, this is another question. The nurse need to put a bedpan in a client, okay? With a recent hip surgery. You need to turn the client, okay, with the pillow between the legs, okay, to prevent when you turn the client to lateral, the legs will drop and will, adduct. And that's why when you put the patient in lateral, you need to keep the abductor pillow between the legs. So you put the bedpan here, and then you turn the client back. Okay, so those are the different movements that you can do with a client with a hip fracture repaired while the patient is on bed. Yes, you need to turn the client to do many procedures: bed bound, bed bath, changing linen, etc. But always when you turn the client to lateral, must be the nose on the non-surgical side and with the legs separated, even if they are turning, okay, turning the client in lateral, all with the leg separated by the abductor pillow. Don't forget that. Because if you don't have the abductor pillow when the patient is in lateral position, this leg will fall and then will have dislocation of the hip. Easy. Which client should the nurse report with priority? A prioritization question. Child with pneumonia and fever 102. Child with generalized rash after eating peanuts. Child with hyperextended arms and feet pointing downward. Child with meningitis and opistotinous position. So what is the priority here?
D. D is as in baby.
I would say B, having a allergic reaction.
For me, it's D.
D as in David.
As in David and
B as in boy.
yes in boys is the two options that you're giving me. And why not the child with this cerebration position? Why you don't choose C?
Because it's critical, so.
Well, precisely the critical client need to be seen first.
I know, but doesn't have solution.
This is.
It can have solution.
Yes.
If there is a brain edema producing the brain edema can be aggressively treated and can be reversible. So it depends. If you have a question, a patient that has been for 6 days in this position is irreversible. But you have a client that develops any of the decortication, deceleration position as a new appearance, these patients can be treated. Don't ¿cómo se dice esto? No, don't
assume
or discard as a possibility of improving patient, okay, that have decortication or deceleration position. Okay, of course, are very serious condition, but don't discard that. Okay, so the opistotinus is an expected position in pediatrics, in children with meningitis. The opistotinus position is expected in children with meningitis, especially small children. Okay, the opistotinus position. Okay, this because precisely is an antalgic position. It's reduce the pain. Okay, so the opistotinus position is expected in meningitis in pediatrics. Okay, this is a position that is found frequently in small children with meningitis because this opistotinus position, okay, this opistotinus position is an antalgic, anti-pain, pues antalgic is anti-pain position. Okay, it is something expected in meningitis. Is because the inflammation of the meninges along all the spine. Okay, and then the patient will avoid stretching the meninges, adopting the opistotinus position. Okay, the opistotinus position. It's very common in pediatrics. So change your concept that in pediatrics, because it's a question of children, opistotenus in meningitis, the same as fever, the same as Kearney-Brusinski, the same as photophobia, are expected findings. Okay, Kearney-Brusinski, stiff neck, fever, photophobia, opistotenus, or bulging fontanelle are expected findings in client with meningitis. Maybe the question is too brief and there's wording that are missing. Okay, but I suggest ruling out opistotenus because it's not a specific finding that translates more or less severity of the meningitis, because this is an antalgic position. I'm concerned about the child with the peanut stuff, the rash, no, because it can be announcing more serious, okay, stuff, okay. The child with pneumonia and fever is expected. Remember that all those children are hospitalized when there is a question like this. The nurse arrived to the chief and you know, and probably they are going to be child with new onset of hyperextended arms and feet pointing toward. So in relation with the decortication, the celebration position is very different. The meaning, if it is something that has been for a long time, okay, for days, or that is, in this case, is irreversible, or versus something that has been found as a new onset. So take care with that. So if I were in my Nclex, I repeat, I will be between B and C. The question, the way that I have the question written here is deficient. So it's too brief, it's too concise, it's too lacking information. I like to choose C. That they specify child with new onset, hyperextended arms and feet pointing downward. I hope that you are understanding me and you're paying attention to me. If you see a similar question in which this position has been for days, it is something that is irreversible. I agree with you. But if they say that is a new onset of this position, is something that can be reverted. Okay, brain edema produce this phenomenon and could be reverted. Okay, brain edema can be reverted, need to be reported and reverted. But if I were in my Nclex between B and C, because I discard this and this, and I be paying attention to C as a priority if they say child with new onset hyperextended arms and feet pointing downward. This is what I think. Okay, but this is what I can tell you about this. A client meeting with tension pneumothorax has a chest tube connected to a closed drainage system. The nurse observed a gentle but continuous bubbling in the suction compartment. Which intervention must the nurse take? Report to provider, check the connection for a leak, document the finding and continue care, clamp the chest tube and call rapid response team. What do you answer in this question?
Sí, hacen cat.
Document the finding.
And it's in CAT because it's an expected finding. In the suction chamber, which is the last of the three chambers, as classically we represent it, we should have, if it is connected to wall suction, we should have a continuous bubbling. It is expected continuous bubbling in the suction chamber. Where is not expected continuous bubbling is in the water seal, the middle chamber, the second chamber. In this chamber, the bubbling should be intermittent, should be yes, no, yes, no, yes, no, intermittent. But in the suction chamber is continuous. So it is expected, and for that reason, we document and continue our care. The nurse calls the rapid response team for a client admitted with a dissecting aortic and abdominal aneurysm. Which finding should the nurse expect? So finding expected in AAA. Back pain, yes or not?
Yes.
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 Remember that
Yes.
aorta
Yes.
is a very retroperitoneal, very back organ, blood vessel. Is practically with the spine, near the spine. Ecchymosis. Ecchymosis means a bruise on groin and scrotum.
Yeah.
No.
Okay,
No.
yes,
Yeah.
this is characteristic in men, of course. Okay, it is characteristic. And AAAs are 99% present in men. Okay, very rare can be present in women, but 99% in men. Okay, so that's why they say groin and scrotum. It can be present in women. You cannot exclude women, but are definitively majority more common AAAs in men than in women. Of course, older men after 65, ex-smoker, any amount of smoking, okay, even any amount of smoking, okay. And of course, hypertension are the risk factors. Hypertension, smoking, and being a male, an older male. This is the risk factor. This is characteristic, right, guys? It's very common when you have a dissection of the aorta that you see the same way that you see the colon signs in hemorrhagic pancreatitis and the Turner signs, Turner and colon. You remember? Eugene and Turner. Okay. Okay, you can see in the scrotums, okay, in the scrotum, you can see a bruise, okay, a bruise in the perineal area, in this case. So something new to incorporate, okay, in the AAA. Bradycardia.
Yes.
Yes.
No. Oh, why bradycardia? The patient is in stress. The patient is bleeding. The patient is in critical
shock.
condition. Is in shock. Is in, ¿cómo se llama? In pain.
Yeah, está aquí.
¡Piles! Ay, Dios mío, se salvan de que yo no estoy allí. Zapato. Quito el zapato. Me quito la bota. Okay, so tachycardia, guys. Tachycardia. Tachycardia. The bradycardia. When you have somebody with bradycardia, first, see if it is an athlete. Yes, it's an athlete. Okay, could be a sign of bradycardia. Second, ask if they are taking beta blocker or if they are taking calcium channel blocker, the non-dihydropyridine. I mean the diltiazem or verapamil. Third, if the patient is critically ill, you know what is critical ill? You know what is the letter J? What means the letter J? No,
Yes.
this is critical ill. Okay, so think in Cushing triad. So increasing intracranial pressure, Cushing triad. Cushing triad. You know what is Cushing triad? No, bradycardia, systolic hypertension. Okay, or is having autonomic dysreflexia. Autonomic dysreflexia. You know, spinal cord injuries above T6 and has urinary bladder distension. Yes, autonomic dysreflexia. Okay, could be a patient with myxedema coma. Myxedema coma. Coma. You know what is myxedema coma? It's severe hypothyroidism. What else, Vaji?
Spinal shock, Professor.
Okay, is when and could be in a spinal shock, right? In a spinal shock. Spinal shock, right? Spinal shock could be also an example. Okay. And if you rule out all these sinus bradycardia that are the weird, exceptional, manifestation of a client in distress, then you need to go to AV block. AV block. In this case, there is no sinus bradycardia. In this case, is AV block. Okay, so those are the situations where you see bradycardia. Okay, the rest, tachycardia. You are in pain, tachycardia. You are fever, tachycardia. You have low oxygen, tachycardia. You have low blood pressure, tachycardia. You owe money, tachycardia. You didn't pass the exam, tachycardia. You know.
Heart attack.
Okay. So remember that tachycardia is the common situation when you are in distress, because you activate the sympathetic nervous system, and just a few exceptions are bradycardia. So don't confuse that again, okay, please. Weak pedal pulses, yes or not?
Yes.
Yes.
Yes, because precisely there is an impairment of blood flow toward the distal to the aneurysm, to the iliac arteries and the lower extremities arteries. Hematuria.
Yes.
No. No.
No.
No. You can have involvement of the renal arteries, and in this case you will have acute renal failure, pre-renal acute renal failure, but no hematuria. No. Hematuria, think in one, kidney stones, the most common. Two, trauma, kidney trauma, bladder trauma, and three, the glomerulonephritis. Okay, those are generally autoimmune diseases, the glomerulonephritis. Those are the most common for cancer in the bladder or in the kidneys, no? So those are causes of hematuria, yeah? But no. Increased abdominal girth.
Yes.
Yes.
Yes,
Sí.
because precisely all the blood that is spilling there increase the abdominal girth. Those are the characteristics by the book of abdominal aneurysm. The nurse discovers that a chest tube has become disconnected from the main connection site of a closed chest drainage unit. What immediate action should be taken by the nurse? Cover the insertion site with a sterile petroleum gas pad, submerge the distal end of tube in 2 to 4 centimeters of sterile water, reconnect the drainage tube to the chest tube, clamp the chest tube nearest to the client with a rubber tip hemostat. Okay, so what is your recommendation? So remember, the client has in the chest, this is the client, okay? The client has in the chest a tube. This tube should be connected to a tube of a chest drainage unit, no? And then they become disconnected. They become disconnected. So they disconnect. What you do in this case?
B as in boy.
Yes, you find a bottle with water, and then you submerge, okay, the tube under the water. Meanwhile, a new chest drainage unit is brought, and you reconnect the drainage tube, okay, to the chest tube, but a new one, a one that is sterile, because the old one fell on the floor and is contaminated. You understand? That's why this is what you do. Of course, meanwhile, you are holding that with your hand. No, you are holding that with your hand. Okay, and then when the new one arrives, you reconnect. If the one that is dislodged is the own chest tube, and you have a hole in the chest wall, the first that you do is to place a gas, okay, over the the hole, and you tape only three sides. Yes, this is what you do if there is a chest tube. So you need to be very careful when you have this kind of question to understand what is disconnected. No, and I draw the two possibilities. A male child with Kawasaki disease receives treatment with IV immunoglobulins and salicylate, is receiving this treatment. Which vaccines are contraindicated? Select that apply. DTaP, MMR, influenza, varicella, rotavirus. Which one are contraindicated?
The live virus?
Sí,
Bacteria
Sí,
would be
sí, influenza.
sí,
Okay. Influenza is contraindicated. Why? Because it's receiving
Aspirin.
salicylate. Yes.
Yes.
Which one? Which else?
D as in David.
This in the varicella is contraindicated because the same reason is receiving salicylate. Influenza and varicella can produce Raynaud syndrome. Yeah. Raynaud syndrome. If the client is receiving salicylate and the client is a child, and children is that one that has Kawasaki, and it has influenza or varicella, or is receiving the vaccine of influenza varicella, they can have Raynaud syndrome. Any other?
No, I don't think so.
Okay, the MMR should not be given because the client is receiving immune globulins. The immune globulin will kill the live viruses of the MMR. You understand that? No?
Yes.
No, it's new for me. Yeah.
Yes, Professor,
Okay,
yes.
so you need to know that MMR and varicella are live viruses.
Virus.
Should be given after 1 year of age, because in the first years, the first 12 months of life, the baby has the immune globulins passed. Immune globulins are antibodies. Immune globulins, okay, immunoglobulins are equal antibodies. Yes, these antibodies in the first year come from mama, Yeah, mama passed baby the immune globulins through the placenta and are going to last almost a year. Babies are protected by the antibodies of mama, okay, in the first year. That's why mama receive vaccines, boosters of vaccines like the Tdap, okay, Tdap, yes. Yes, Tdap during the pregnancy to increase the antibodies against tetanus, diphtheria, and pertussis, receive the vaccine of the influenza, etc. So baby is born with very high level of antibodies. That's why they don't have those diseases during the first year. But after 1 year, those antibodies worn out, and then they start receiving the vaccine. If they put the vaccine before 1 year, mama antibody will kill the virus, the live virus. But the same happens if the child is receiving immune globulins injected as part of the treatment of the Kawasaki disease. Immune globulins, I mean antibodies, gamma globulina, okay, are given as part of the treatment of Kawasaki disease. Yes? And they improve a lot of the Kawasaki together with the salicylate. But then these immunoglobulins will kill the live virus of the MMR. So the client should wait almost 1 year, they say 11 months, after receiving immunoglobulin to receive a live viral vaccine, because then the vaccine is going to be like injecting water, because the viruses are going to be killed by the immunoglobulin. So the answer to these questions B, C, and D. Is clear now? Okay.
Yes, I understand.
Okay. Client taking rosuvastatin. Clients finding the nurse report immediately muscle pain, nausea and vomits, loss of hearing, headache.
Muscle pain?
Muscle pain. This is rhabdomyolysis. Muscle pain and muscle weakness, a manifestation of rhabdomyolysis. Emil Klein, without known previous disease is admitted for elective surgery and is accompanied by his wife. Routine exams are practiced. The client HIV test is confirmed positive. The nurse is ordered to inform the client. What should the nurse do? Communicate the result and explain his wife that must be also tested. First, explain to the couple that HIV can be treated and controlled with effective treatment. Ask the wife to leave the room and inform the client of the result. Consult the supervisor about the facility policy to give clients information to significant ones. What is the right answer?
Sí.
C as in cat, you
Sí.
know, C as in cat. You need to ask the wife to leave the room, ask the client how prefer to be given the information, and then give the information to the client. If the client wants to be given the information in presence of the wife, then you ask the wife to enter, okay? So you need to ask the client what the client wants about this, how to deliver this information in private without any information given to the wife. Which client should the nurse see first? Client with type 2 diabetes with blood sugar 320. Chemotherapy with white blood cells 1600 sulf, leukopenia. Renal failure with potassium 5.6 and COPD with CO2 in 50. Which one is the highest risk of this for client?
C.
Sí.
Okay. Everybody agrees,
I
no? That
think
the client with the high potassium is the one that has the highest immediate, okay, risk of having a ventricular dysrhythmia. The other clients need to be attended, but can wait. All those clients can wait. The COPD is used to this CO2. Which of the following infectious diseases require contact precautions so that apply? Tuberculosis, yes or not?
No.
No.
RSV, yes or no?
Yes, and droplet too.
Yes. RSV doesn't require droplets, only contact. Okay. Very rare situations like RSV that need to be suction, etc., requires wearing mask, but by standard because you spread a splash standard. RSV is only contact. Herpes zoster, yes or no?
Yes.
Yes.
Yes. Conjunctivitis, yes or no?
Yes.
Yes.
Yes. Hepatitis B, yes or not?
No.
No.
Scabies, yes or not?
Yes.
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 Client has been ordered warfarin for DVT 1 month ago. The INR is reported 0.8. What should the nurse do first? Notify the provider, administer phytonadione, withhold the next dose, ask for treatment compliance.
Sí.
Can you repeat?
Sí.
C as in cat. I have problems understanding because I have deafness, I have hearing problems, and all have hard hearing. A part of the presbyculosis have a hearing problem. Trying to say a word because it's not only me. A lot of people don't understand what you're saying. Would you say C as in cat?
No, I'm
D.
sorry. I'm
D.
sorry.
No.
No,
D as
that's
in David.
B has a
Okay.
boy.
D
B
as
as
in
in
David.
boy. Okay, B as in boy. Okay, phytonadione is vitamin K.
K.
The INR should be between 2 and 3. If the INR is 0.8, the patient is not taking the warfarin at all because your INR probably is this, and you are not taking warfarin. So you don't need to give vitamin K to a person that is not taking warfarin. If the INR were, let's see, 6, higher, above 3, and the patient will be bleeding, I accept you giving vitamin K. But in this case, there is not need of giving vitamin K or withholding the next dose. So obviously what you need to suspect that the patient that has the INR 0.8 being prescribed warfarin, the patient is not taking the medication. Are we good? Don't confuse this question. Okay, guys, this is what I have for you today. Any question, any doubt?
No,
So,
thank you,
you say
Professor.
D? Thank you, Professor.
My
Thank
pleasure.
you. Have a great night, Professor.
Good
Thank you.
night. Bye-bye.
Thank you, Professor.
Thank you,
Bye.
Professor.
See you
Bye-bye.
Thursday.
See you
Thank you,
Thursday.
Professor.
Study a lot, okay?
Thank
Yeah,
you.
thank you.
173.